Assalamualaikum.
Waalaikumsalam.
Salam.
It's 8 students, 7 students, 1 minute. Remaining are busy, have lecture. Where are the remaining? They have class. Hello. Let's start. Give me a response. Hello.
Sir.
Let's start.
Yes, sir.
Yes.
I'm thinking my students sleeping. Yes, last class we start about drugs for heart failure. In heart failure, what's the main problem? Preload also high, afterload also high. Heart patient having MI, patient having angina, patient having cardiomyopathy, myo, patient have valve disease. Okay, so all these diseases they make your heart more weak. Understand? Heart becomes weak. Then heart not able to maintain cardiac output. Cardiac output going down. So your blood pressure depend upon cardiac output multiplied by resistance. Understand? Cardiac output having two parts, stroke volume and heart rate. The stroke volume depend upon contraction. So if your heart become very weak, your blood pressure going down because your cardiac output is low. Heart contraction weak. Yeah, heart now diseased heart having some disease. So what if two systems start? Number one, RAS, angiotensin 2, and ALD. ALD doing what? Increase ALD increase water absorption. Yeah. So water absorption means you increase plasma volume. Plasma volume increase, more blood is returning to heart. So angiotensin 2 doing what? Causing vasoconstriction. Angiotensin 2 increase after load. After so one system is working. Another system also excited sympathetic. Sympathetic system causing what? By alpha 1 causing vasoconstriction. increase after load. Understand? So if your heart, this is good. These two conditions, sympathetic and RAS system, help to increase the cardiac output by increasing the load and afterload. But if heart is not much healthy, heart undergo which failure? The compensated heart failure. Then preload increase, afterload increase. Now they're doing what? These both things make heart failure more. Understand? This I already explained. So if you want to treat heart failure, I just simply give you example. One young person can lift, young person 50 kg easily. Now age 70 years, very elder. That elder person can lift 50 kg? Of course not. Just can lift 5 kg. Just 5 kg. So what is the difference? Young is more healthy. Yes, young is more healthy. Elder person now healthy, not good health. So that's the difference. So can't lift extra load. So after disease, heart become, after disease, what happened with heart? Heart weaker. Yeah. Can heart lift the load? Same load. Can heart lift the preload? Can heart lift the afterload? No. So you must reduce the weight. Understand? You must reduce the load. Yesterday we start the drugs for producing the main thing here, RAS system, to reduce the preload and afterload. We're using the first group, RAS blockers. RAS. In RAS blocker, the first one, renin blocker, aliskiren. First one, renin blocker, aliskiren. Okay. The second one, the important drugs here, angiotensin converting enzyme inhibitor. In this family, we're having pril, enalapril, lisinopril, ramipril, captopril, name here, pril. Another angiotensin receptor blocker. Angiotensin receptor blockers. Yeah. They block angiotensin receptor. Their name sartan. Val, candy, low sartan. Candy sartan, val sartan, low sartan. Understand? Valsartan, candesartan, losartan. So these are ARB, angiotensin receptor blocker. And the last one, aldosterone antagonist. Aldosterone antagonist. In this drug, we are having group spironolactone. Spironolactone. So these drugs, they block the RAS system. Yes. So if you block RAS system ALD, so what happened with preload? Decrease. If you block angiotensin 2 or conversion or production of receptor, what happens with afterload? You understanding or not? Give me response. RAS blocker, they reduce preload also. So they reduce afterload also. That's why the gold standard drug for heart failure here, RAS blocker. Very effective drugs for heart failure. For heart failure, we prescribe RAS system blockers because in pathogenesis of heart failure, the key system involves RAS system. So we must block first RAS system. Understand? What are the side effects of angiotensin converting enzyme inhibitor? Yesterday, last class, I already explained the side effect. The side effect. What's the side effect? If no angiotensin, what happens with aldosterone? No aldosterone. If no aldosterone, sodium loss. If no aldosterone, potassium become high. Sodium low, hyponatremia, hypokalemia, hypovolemia, hypotension. Okay, because you block the RAS system. Hypotension, hypovolemia, hyperkalemia is very dangerous side effect here. Okay, another side effect, angioedema. Angioedema. Another side effect, phytotoxicity. Never use RAS blocker in pregnancy. Phytotoxic. Okay. Another side effect, converting enzyme inhibitor, they having side effect like dry cough. Okay. What are the side effects of ARBs? ARB side effect? Same. Not include which one? Not include dry cough. Understand? So the side effect of angiotensin converting enzyme inhibitor and ARB. Clear? Heart failure, two system activated, RAS. Yeah. In RAS, we having two things, angiotensin 2 and aldosterone. Aldosterone causing what? More venous return, more preload because it's causing water absorption. Done? So angiotensin 2 doing what? Vasoconstriction. So increasing after you. Understand? So how you can reduce after? Question here, how reduce first one, reload, how we can reduce afterload. Oh, what is preload? 601. How you can reduce preload? If you block ALD, so volume will decrease. Understand? So afterload, how you can reduce? As vasodilation. If you cause vasodilation, then resistance decrease. Yeah, so afterload will decrease. Vasodilation. You need here vasodilation. If you block angiotensin 2, can cause vasoconstriction? No. Clear? So we have two drugs here. One angiotensin converting enzyme inhibitor, another angiotensin receptor blocker. In same way. Okay. They block the receptor, they block the production of angiotensin. So these drugs So in the drug family, you already know the name Pril and Sartan. Pril and Sartan. Pril, I just tried the one name, Enalapril. Sartan, Valsartan, Losartan. So these drugs are doing what? They directly decrease the, try to understand, afterload. Understand? Why? Because they not allow angiotensin to production. Another thing, they not allow angiotensin to pass proper working. Block the receptor and Prill family block production. Yeah. So what happened? Afterload decrease. Afterload decrease. So this is the principle of therapy in heart failure. We must reduce the afterload and preload. Okay, another thing, how we can reduce preload. Another drug, preload. We want to reduce preload. What do you think in heart failure patient? We also use diuretics. We also use diuretics. Okay, diuretics we will learn in detail in renal section. Okay, thiazide and thiazide and loop. These two main groups. Loop diuretics and thiazide diuretics. So heart failure we prefer mostly thiazide diuretics. So these diuretics they causing what? They cause diuresis, mean loss of water in urine. So if water loss in urine, what happen with volume? Plasma volume. You guys follow me, okay? So give me response and I can understand you guys are getting the point. Someone open the mic. Diuresis, volume decrease. So volume decrease means preload decrease. So how diuretics treat your heart failure? They decrease the preload. Understand? They decrease
Yes, sir.
the. Uh, so someone also give me response, okay? So I can understand you guys are getting my points. So preload will decrease, preload volume decrease. So how diuretics? So ask question here. How diuretics treat heart failure? Let me know. I'm writing here option here, okay? Increase preload, B option. Decrease afterload, C option. Decrease preload, D option. None. Let me know. What's your answer? How diuretics treat heart failure? Diuretics doing what? Remove volume from your body. Volume mean preload. Volume mean preload. So we need to stay focused on preload. So if you decrease volume, this means you decrease preload. We must decrease preload in heart failure. Understand? So decrease preload is the answer here. How diuretics treat the heart failure? Decrease preload. Really clear? Okay. Another group, third group, vasodilators. Vasodilator they cause dilation. Vasodilator they're doing what? They decrease afterload. Understand? They decrease. Vasodilator doing what? They decrease afterload. For example, it's a heart. If you open the aorta full, so heart easily can pump. Yeah. So if you make this aorta more narrow, then heart need more force for pumping. So this one picture. In one picture, you can see the aorta or vessel narrow. So how about the afterload? More. Yeah. How about two? You can see very big size here. Very big size here. Big size. So afterload is little. Understand? So vasodilator they decrease the afterload. Vasodilator they decrease afterload. Really clear? Vasodilator they decrease afterload. If you dilate the artery, it's more better. If you dilate the artery, so arterial dilator very easily they decrease afterload. They decrease afterload. If you dilate the vein, they decrease what? If you dilate the vein, they decrease preload. Listen here. Is the heart in the center of it? Artery connected to heart, blood going to heart to the tissue. Yeah. Now blood come back with the help of vein. Understand? It's a vein here. This you already know in physiology. Venous return affected by gravity. Yeah. Standing person very hard, laying person more easy. So if you dilate the vein, if vein become very big, now you guys tell me, can blood return easily? Let me know. Can blood return to heart easily? Give me answer. If you dilate the vein, can blood easily go back? Anyone? Safira, ready?
I think hearts are.
So it's hard to return back, yeah, because you dilate. If you dilate, so what happen? Venous return decrease, yeah. So it's mean the blood enter to heart decrease. It's mean what's your venous return? Venous return equal to preload. Is here preload. What happen? Preload decrease. Understand? So if any drug dilate the vein, decrease the preload. Okay, listen here carefully. If you dilate the artery, just dilate the artery. If you dilate the artery, now you can see heart easily can pump, yeah? Heart easily can put out blood because you make the artery more bigger. So arterial dilation. If you dilate the artery, it can decrease which thing? Afterload. Understand? Okay. Drug acting on artery. Write the name here. Hydralazine. Drug acting on artery. Hydralazine. Which drug? Hydralazine. Clear? So now let me know. Hydralazine reduce preload or afterload? Hydralazine reduce preload or afterload? Hydralazine. Hydralazine just dilate the artery. It reduce preload or afterload? Hmm? Hydralazine Reduce which load? After load, preload. Alkyls are silent. Hydrazine doing what? Find out. Arterial dilation. Artery dilate reduce after load. Vein dilate reduce preload. So hydrazine decrease after load. Another group, nitrates. We not frequently use for heart failure, okay? This we prefer for ischemic heart disease. Nitrate also act on artery. Nitrate also act on vein. So nitrate doing what? They also reduce after load. They also reduce preload. Understand? If you dilate the artery dilation. Which thing reduce? Uh, If you dilate the vein, which thing reduce? Filling of the heart. Breathe. Nitrate. Nitrate act on artery also, act on veins also. How about the hydrazine? Hydrazine act on only artery. Arterial only drugs. Must keep in mind it's just for arterial dilation. So it reduces what? After. Understand? Hydrazine reduced after. The side effect of hydrazine is important. The hydrazine causing hydrazine SLE. Must keep in mind this important side effect. SLE. SLE caused by hydrazine. SLE caused by hydrazine. Clear? Till now, till now we done. Okay, another group. We also use beta blocker. Which beta blocker for heart failure? This we done in adrenergic system. Carvedilol, labetalol, carvedilol, and labetalol. Labetalol. We also can use other like atenolol, bisoprolol. So beta blocker we also use in heart failure. So now for heart failure we have medications. For heart failure or medications. What medication we use for heart failure? First we use RAS blocker. First we use RAS blocker. RAS blocker angiotensin converting enzyme inhibitor, angiotensin receptor blocker, and aldosterone antagonist, and renin inhibitor. So these drugs will be the first line for heart failure. With all these drugs, receptor blocker, enzyme inhibitor, they reduce preload, they reduce afterload, also reduce preload, also reduce afterload. And aldosterone antagonist reduce preload. Another group we use diuretics. What the diuretics doing? Diuretics, which diuretic? Thiazide. and we have lead. So diuretics, they how to treat heart failure, they will use preload. Another group, arterial dilator, hydralazine. Hydralazine. Hydralazine dilate the artery, reduce afterload. Clear? And next, nitrate. Reduce preload, also reduce afterload, because these both things are vasodilator. Okay, vasodilator. Both things are vasodilator. Clear? Reduce afterload, preload, afterload, preload. So all the therapy done. Another important drug we use, last one here, beta blocker. Beta blocker. Beta blocker non-selective, alpha and beta together. Labetalol, labetalol, carvedilol. Labetalol and carvedilol. Labetalol doing what? Labetalol block alpha 1 and also act on beta 1. Reduce the heart rate and also help to reduce vasoconstriction. Also has to reduce the afterload. The beta blocker, let me prefer for heart failure non-selective beta blocker. Also go for alpha and beta. Okay, labetalol and carvedilol. So now all this medication done. First one, the second group, this one third group, this here fourth group. Okay, first we treat the heart failure patient by using this one. If the patient still not getting well, like patient not tolerate, not tolerate, or patient response not good, so then what we do? Before we just doing decrease afterload, decrease speed, because heart. Why you doing this? Heart already very weak. Heart contraction very weak. Okay. So now when the person is still not improving by using these drugs, last blocker, diuretics, and vasodilators, beta blocker, and what you can do in last here, we use another group, inotropics. Inotropics. What's mean inotropics? These drugs, they increase calcium inside. When calcium inside increase, contraction much stronger. Contraction increase. So now we try to contract the heart strongly, because heart is no more giving response to preload, decrease, and afterload, with further failure and failure and failure. The last form,
Sudah selesai, Kak? Red.
Antar aku bagian lagi yang coba masuk